Welcome back, everyone, to another episode of the Optimal Body Podcast. I'm Dr. Dom.
I'm DocJen.
And today we are going to be talking about how to optimize our thoracic spine health, or that upper back area. What types of things do we need to do to become more stable where we should be stable, mobile where we should be mobile, and optimize that area. So let's get to it. Okay, so this is episode 3 of our full body optimization series that we're doing on our podcast. And it's part 3 of the spine series. We've already done low back and neck. And next we're going to be moving into hips and shoulders. So we have so much coming up in how to optimize all these areas of the podcast. So we want you to be sticking around so you can best benefit from all this incredible information in this full body optimization series. So if you want to be getting notifications on it, please click that subscribe and notification bell. Also, comment below if there's a specific area in the body that you want to make sure we do an episode for as a part of this whole body optimization series.
Now, this is a big one because I think it relates to posture a lot of how I should be standing and how to reduce the hump in the back of my neck, which we've actually done a podcast on. Say you don't specifically have pain, but you don't want to have pain in this upper mid-back region. Or we want to optimize even how we're reaching overhead, hinging and deadlifting, squatting, how we're moving, how our posture is. And this is all like what we're doing to optimize what's happening around this upper back.
One of the first things that comes to mind is posture and is that rounded shoulders. And we are specifically leaving that to last to talk about, because we'll kind of touch on throughout how to adapt posture. Can we change posture? But we're leaving that as the last global point that we're going to talk about in this episode. But we want to just start by talking a little bit about the structure of the thoracic spine. I mean, overall, it is the majority of our vertebrae. It takes up the most as far as the number of vertebrae, and it is seen as an area that should be slightly more mobile. We tend to have that forward rounded curve in the thoracic spine, which is normal, I think. And good to have that forward curve in that thoracic spine. I think people just tend to associate it with a really, rounded forward hunch.
How do we reduce falling prey to increasing that flexion as we continue to age? And how do we optimize maintaining the curve, but maintaining the mobility of that upper back? And so we want good rotation of this upper back, especially when we walk. We don't want to be stiff and rigid when we walk. And this is where we pull most of our mobility, is from that upper back. And then that translates into the hips and how we're moving through the pelvis. So if we can move well in our upper back, then it helps to translate everywhere along the body as well. And even when we reach overhead, we don't want the low back to be doing a lot, or we don't want the neck to jet forward. We want that upper back to naturally extend really well so that we can get our arms overhead a little bit better.
Thoracic spine and our upper back should be more mobile.
It's getting that understanding of where I'm moving from and gaining better awareness so that when I put load on my body and I create more tension, I have a better use of my muscles from everywhere, from shoulders down to pelvis or all the way down to feet, right? Yeah. We'll talk about some movements that you can do, but ultimately it takes time to build this awareness within your own body. It takes time and practice and continuing to do it every day over and over again.
Essentially, it comes down to we don't want you to move into the extreme ranges in a way that your body's not prepared for.
Right.
There are people that we know that do move into extreme ranges under heavy load, but they've trained their body for years, if not decades, to do that.
Right. And progressively over time, understanding, and they have better awareness of understanding how to control that, not move as much into that spine and find more stability, and then also be able to find more mobility with the load. So it's really so important to gain this awareness and distinction within our bodies. One thing we like to kind of talk about when you're doing more of a hinge movement, so think of more of a stiff-legged deadlift or even just a regular deadlift. One thing I like to say is if I have a weight kind of in front of me, almost like I'm gonna do a goblet squat. So I bring a weight out in front of me and I kind of squeeze squeeze my elbows together and have that weight up by my shoulders and chest, if I do that motion just sitting, you can kind of feel that kind of lifts and opens and extends that upper back. And I'm creating tension into that core. Well, now I'm going to just barely bend from my knees, but really sit my hips back almost like I'm closing a door, or I'm a foot away from the wall and I'm trying to just touch my booty to the wall without anything else. So that helps to create more of like that opening from the back of the pelvis to open and hinge from my hips, while still holding those elbows in together and keeping a little bit more extension and pressure through that trunk and upper spine. So that can potentially help to start to build that pattern and awareness just in that hip hinge, so that you're not rounding from that and gaining that mobility that's natural in that upper back.
And then on the other end of the hinge, when you're standing up into like the extension, if you're like coming up from that deadlift, a lot of people will they think that to get into the full hip extension or to activate those glutes, they really need to squeeze forward. And while yes, you're probably squeezing into your glutes, many people will also way overextend into that low back in a way that's unnecessary. So using that tension that you create in the kind of thoracic spine area to also then kind of encourage the ribs to stay down, squeeze into the glutes, but almost feel, I feel like when I started learning how to do this well, I almost felt like I was a little hunched forward when I would squeeze and get to the top of a deadlift, because it was so foreign for me to not overextend in that low back.
Think of your glutes as the thing that's powering you to come up, not to stay up at the top, right? Like we use our glutes to push the ground away from you. That's why we think, oh, I'm going to really work my glutes by squeezing more at the top. Well, no, they're going to work by opening really good at the bottom and then pressing the ground away. So instead of lifting the weight back, that kind of sometimes creates that overextension. I'm just pushing the ground away. And like Dom said, maintaining that good stack of that rib cage over that pelvis.
Yeah. The next place that we wanted to kind of talk about was an overhead press. Like everyone, a good quick test you can do is just stand up quick and lift your arms over your head. Pause there now. Don't change anything. What did your low back do? What did your neck or your head do? And that's unloaded, right? That's with no load or resistance applied. Now imagine it, or try, if you have dumbbells that you feel like would be a relatively heavy shoulder press for you, maybe you could do 5 or 8 reps of it. Now try to press that overhead. What do you feel in that low back or that neck? Many people, myself included, I used to have a huge tendency to way overextend in that low back and kind of jut my head forward as I press that weight up. And this is coming from compensations for many different reasons, but a good way that you can feel something different is sit on the ground, right? And this is called like a Z press. Sit on the ground and do a Z press, or a seated shoulder press, essentially. I don't know why we give things fancy names that people don't understand. It's a seated shoulder press. To sit on the ground, this helps keep that low back locked or more in a neutral position. So even if you wanted to, you can't really extend.
Or you fall backwards.
Or you just fall backwards. Totally. You don't even have to take a heavy weight to like start out. You could take 10-pound dumbbells, whatever, 5-pound dumbbells, and then press overhead and feel what that feels like to have your core or your low back more in a neutral position. Do you struggle to get all the way overhead without feeling like you might fall back yourself?
Yeah.
Because especially if you have limitations in thoracic extension or shoulder flexion, it might start pointing out some of the places that we need to work on that thoracic mobility, maybe some shoulder mobility as well.
Yeah, I love that one because it really, like you said, locks out that low back. And then one of my favorites that I had learned is a squat. And what happens, and I think what we've been conditioned to learn from a squat, is to stick the bottom out to initiate the squat. So that kind of already puts you into that low back, kind of getting into that extension. And then squat, hips back, stay really far into your heels, right? And then stand up and squeeze your glutes. So all we're doing is tilting those hips forward and getting a lot of extension in that low back, and then tilting under and getting flexion in that low back. And we tend to overuse our mobility through that low back in order to create that squat type pattern, where really a squat should involve just the pelvis going straight down to the floor as much as possible and the knees going forward with that squat position. So we do want the knees to translate forward. That's going to get better ankle mobility, better foot mobility, better trunk control. And obviously this looks different for different people, but that is the goal of a squat. It's going down and up, different from a deadlift that's going back and forward, right? So one of the things that I like to do to help support the movement of the low back and thoracic spine is kind of hugging like either a really big pillow or like a poof, I like to say. So we have like these poofs at home that I like to, an ottoman essentially. And you kind of, it makes you kind of round and protract those shoulder blades a little bit, but it's going to help to control that spine. So now I'm set up in that natural rounded position of that upper back. And if I take a breath in and I open my knees and just let that bottom try to go straight down to the ground, well, then I don't really move from that low back. So in that hugging position, I can't really extend from that low back. It kind of locks me from being able to do that. So I hug this thing and I take a deep breath in, letting my knees go forward and out as I squat as far as I can, and then take a breath out as I come right back up. And it's going to help to kind of engage that intra-abdominal pressure to help stack that spine in whatever alignment is natural for me, and keeps your body a little bit more in that natural spine alignment.
Next big point to optimize thoracic health is thoracic mobility.
Yeah.
We want our thoracic spine to be mobile. Great place to start is passively, just almost getting a nice passive opening of that thoracic spine. But mobility isn't just passive, so we want to progress from that. But to start passively, this is going to look kind of like an open book, but it's almost an exercise that was just going to help you relax into it. So you're going to start laying on your side. Your top leg will be over, pressing down into a pillow or a foam roller or something. And then you just open up. And what we want to do when we're opening up, I kind of like to try and press my front arm forward almost as my top arm is relaxing down towards the ground, and then just hang out there and breathe. And as you take big breaths, expand into that low rib cage. And then on the exhale, try to feel yourself be able to just melt a little bit more towards the ground with that open hand.
Yeah, that's a great way to start to find that opening and that rotation. And then we want to make it a little bit more active. Okay, I know that my body can get into rotation. So how do I actively get into that rotation? A good one that we like to use is just being on all fours in a quadruped position. And sometimes I like to find rotation first in flexion by kind of getting your elbow down toward the ground. And so you let your body relax down, kind of exhale, drop that elbow to the floor, and then inhale as I drive my bottom hand that's on the ground down, and then start to drive my elbow up to the ceiling with a big inhale, and then reach that arm all the way up with that full inhale expansion, and then exhale and drop that elbow down. And so you start to find that ability to rotate a little bit more through that upper back, and being in that quadruped position, hopefully the knees stay down so your pelvis doesn't move too much, and you move more from that upper back.
And then I guess there's a few other steps, but the last one we'll show is called a chop. And this is how we can start to load thoracic mobility. You usually use a band or something that's attached to a door or a rack in a gym or something like that. And for the chop, you can be standing in a lunge.
Yeah, you could stand in like a lunge. You can go into a kneeling lunge.
I mean, you can really do it with any foot position you want. You can be in a lunge with kind of the leg away from the door forward, or tall kneeling with both knees on the ground. You could even do it in standing and just kind of a mini squat. But essentially, you're taking your hands from up towards one shoulder, like whether it's your right shoulder or your left shoulder, it's going to be kind of pointing up and away over that right shoulder. And then you pull the band down to the opposite hip. So if you're going from your right shoulder, you're going to kind of go to the left hip as you rotate through that thoracic spine. I think I was kind of thinking doing it in some sort of a lunge, whether it's a kneeling lunge or standing lunge, because it's going to help focus that movement through the thoracic spine by locking out that lumbar spine a little more.
Exactly. And you could do chops in all different directions, but it's a great way to find that stability through that active, control and mobility. And this also then translates into so many other movements, whether we're now tossing a ball, like this is where we want to be rotating from that upper back, whether you're going for a walk or a run, we want to start, like if we work on that passive and active mobility of that thoracic spine, the hope is that it starts to translate into everyday functional movement, going on a hike, going for a run. We start to move a little bit more naturally from that upper back.
Don't feel as stiff.
Yes, exactly. And then we go into one of our main points, always when it comes to optimizing the health of your body, is how we're breathing, where we're breathing from. If I can start to downregulate my system and change my pattern into my parasympathetic, my rest, relax, digest, instead of my sympathetic and always having my shoulders up into my ears, then I help to relax tension around my body so that my rib cage can move a little better. I can move from my thoracic spine, hopefully help to reduce pain within my body. Everyone right now, like, put your hands on that low kind of rib cage and take a deep breath into your hands. And then just a relaxed exhale. And what you should notice is that it already starts to align the spine. So we start to fall into a more natural posture without forcing a new posture. Because if I expand from my rib cage in a 360-degree manner, it automatically kind of stacks me and puts my head over my pelvis and helps me to find more balance within my system. And that's really what we want to do. Find more balance within your own individual system. So now we start to change our posture. And what we have to realize, especially if we're thinking like, oh, I'm falling into the rounded posture, I'm getting that hump back and all that stuff. Well, this is from years of adaptation. Years.
Yeah, you always get the question on like, how do I get rid of the hump?
Right.
I mean, the follow-up question is like, how long did it take the hump to
develop,
to form or develop, or how long have you been in that type of posture?
That's where I say, it's going to take years to probably start to reverse. And don't get discouraged by that. I hope you get motivated to say there's so many more years left of your life, even if you're older, that can still create change for your body so that you could feel something different, right? And we've mentioned it before, there's no perfect posture, but it's if I'm in a position where I have to be at a desk a large period of the day and many hours, and I'm falling into this more static posture, what am I going to do to reverse that static posture throughout the day and throughout life?
Yeah. And I mean, in talking through all of this, and like I said, posture is one of the biggest topics that comes up. And it's funny that we talk about breath as being something that can help with mobility and posture. And when people ask me like, what's the best stretch everyone should do every day? Breathe, sit down and do conscious breath for 2 minutes. What can I do for my posture if I do something for 2 minutes every day? Breathe consciously, just sit and breathe. And it's going to help you so much with the general tension in your body, but also to start long-term helping your body find a different ease of movement in a different position. And in talking about all the things that we just talked about, if you haven't checked out Gen Health yet, the membership that we have has a neck and upper back plan. So a lot of the components we've talked about in these past 2 full body optimization episodes will be in this neck and upper back plan. And you can go and sign up for free trial. You get a week for free, which helps you do half of phase 1 of that plan. And there's multiple phases. And if you use code OPTIMAL when you sign up, you'll also get a discount on your first month of the membership.
And I think the last little point to just kind of drive home is that when we improve our strength throughout our entire body, we improve our resilience to pain and injury and life circumstances that might happen. So as much as we talk about mobility, and we believe mobility is so important, we also believe getting strong within your body cannot be neglected in all circumstances. So changing your upper back mobility and stability and how it feels isn't just about doing rows and making your back really strong, but it's also about being really strong as we push and we pull and we do it from above and hanging to right in front of us in that row push-up position, So how can we improve our strength overall, double arm, single arm, different planes of movement while we work on improving our mobility and our breath?
Which in the membership, once you're done with the neck and upper back plan, you'll just go over to the full body low impact plan, which is the strength plan. Yes. So perfect transition there.
Thanks so much for sticking around and hanging out with us for another episode from the Optimal Body Podcast. Of course, if you have other things that you recommend that have helped your upper back or mid back pain or optimizing this area of the body, please let us know in the comments because it might support someone else. And if you have any other questions, let us know below.